This is the NAMI 2020 annual conference, and I'm Angela Brand with NAMI California. I am really excited to be part of this experience. For those of you that have been with us for day one and day two, I think our team has done a great job to bring all of this together. We're hearing a lot of great feedback about the different conversations and workshops that have happened. And I'm really excited for the one that we're having here today. As a quick reminder, these sessions are being recorded, so we'll have all of them cataloged and be able to share with you after the conclusion of the conference. Once we pull all those materials together, some information will go out to you all about where and how to access those recordings for this and all of the other sessions that we had here over this 2-day period. So, like I said, today's workshop that we're in now is Spiritual Formation for Residents at Mental Health Facilities. I am really excited to introduce to you our speaker for today, Dr. Paul Liu. He has an extensive and impressive resume of experience and skills. Having just recently retired after more than 40 years in the aviation and aerospace industry, he's now ventured into a second career as a clinical assistant professor at Chapman University. He holds a Doctor of Business Administration degree, a Master of Aeronautical Science degree, a Master of Theology degree, that one having and he's recently received his Doctor of Ministry degree from Fuller Theological Seminary, his research having focused on faith and mental illness. Dr. Liu is an integral part of the NAMI family, locally here at the state level as well as national. He's a board member of NAMI California. He's a member of NAMI National's FaithNet Advisory Group, and he's the coordinator of the NAMI FaithNet program with our NAMI Orange County affiliate. Dr. Liu believes that faith and spirituality can be a significant factor toward recovery for the mentally ill and can also be a source of comfort, hope, and strength for family members and friends. He brings the message of faith and mental illness to all faiths to heighten awareness, remove stigma, and encourage involvement. As the parent of an adult child with mental illness, his experience has motivated him to bring hope, comfort, and assistance to other families in similar situations. I'm going to turn it over to you, Dr. Liu, and we'll go ahead and get started.
Great. Well, thank you very much, and very much appreciate all of the NAMI California folks is making this possible. And I think in many ways it's difficult, but we're all learning. And again, I think that we're all going to walk away with something. So thank you for doing that. So hello everyone, and I'm going to be doing my talk on spiritual formation at residents at mental health facilities, and I'll walk you through what I did. And then I'll also kind of maybe make some suggestions on what I found, and if you're interested, maybe things that you could do, and how we can maybe help to people that may be in residence centers, and they're looking for some form of spiritual formation. What would that look like? So the project that I worked on is really creating opportunities for spiritual formation at residents at the mental health facilities. And I actually went to 2 facilities. One is in Orange County in Santa Ana. That's the Royal Therapeutic Residence Center. And also one in Long Beach, California, the Ocean View Adults Psychiatric Hospital. So I kind of did my work there, and what you're going to see is, how I went about doing it, what I found, and what things may be of benefit for us. Okay, so why did I do this? One is to really provide opportunities for spiritual formation for those who actually need to partake, or come to a faith organization and partake, whether it be logistic issues or other limitations. And it was also an opportunity to provide some community outreach, go out to places other than, within your faith community. And then the third bullet, and you can see that it extends hospitality from faith organizations. About hospitality and what I think I found and then living factors. How did I actually even come doing this? And it all started with a conversation that I had with someone, and this individual says, my loved one is at a facility, and and there's really not a lot of opportunities for my loved one to actually even you know have a Bible study, and it's possible. And that kind of resonated with what I said. Why would you not be able to do that? um, and then I thought about it. So maybe there may be, and why not have opportunities where you could actually maybe reach out to the to the resident centers, if you, and offer beyond Bible study, offer maybe what I'm spiritual formation opportunities, or sometimes what I call real spiritual formation opportunities. So that's really how this whole thing got started. Now, the expected was to contribute to the well-being of the individual at the treatment. And we also know is spirituality is a part of the overall treatment and contribute to recovery and overall well-being. And it can actually help with the speed of recovery as well. And many research actually indicates that. So references that I used, and I kind of use these as almost like help me to create my framework. So there's Donald Capps. He actually wrote several books. One that I really enjoy reading is called Jesus, the Village Psychiatrist. And in this book, he talks about, how we can actually, reach out, and how, Jesus not only heals physical ailments, but Jesus actually may be able to heal emotional and mental ailments. And then you can also see the second book there called Fragile Connection. It's another book that's by Donald Capps. And then the third one is from Henry Nouwen, and it's called The Wounded Healer. And again, I think that gave me a lot of inspiration to, why you might want to go and do this, especially for people that actually understands and knows what it's like to have loved ones that are mentally ill. And in many ways, you're wounded. And then Jean Vanier, from Brokenness to Community, is another great opportunity for me to learn. And Vanier, like Nouwen, they actually went to facilities and literally almost kind of took up camp there. They almost stayed community, community significant part of what the community is. Later on, I'll talk about the importance of community. It's clean, and it actually talks about why maybe we may be hesitant to actually reach out to people that may be marginal in one way or another, and what may be what may be driving that, and what we can do to maybe do something about that. So these are references that I looked at. So from that, I kind of crafted a model where I said, okay, well, there's maybe a couple of pieces to it. So the first piece is to figure out, Jesus the healer, and can Jesus really heal mental illness? And if it is, what would that ministry look like? And as you can see, I referenced Cap and Beck and Culpepper to kind of help me develop that. And then once I developed that, I said, okay, well, how do we actually then do this? How do we actually have a ministry like this, and what would this look like? And that's this sex. And then the third part says, okay, if these are the various components, and if you look up here, you can see the components of what should be in the ministry would be significant items like hospitality, communications, and so on and so forth. I won't bore you with the details, but again, we'll get back to that in a little bit as well. And part 3 then says, okay, how would I do that? Okay, and then I referenced Carl, and I'll tell that to you. He actually put a paper on, hey, this is what I did when he went to many of the facilities that he was participating in. So, in part 1, can Jesus heal mental illness? And again, in my travels, I get that question a lot. Can Jesus heal mental illness? And and then many times, if you're studying, if you believe, we say, well, what does my scripture say about this? And then you can kind of see that I referenced a Bible scripture from, but it's from the Bible is called The Message, and it's written by Eugene Peterson, and it's the more modern version, if you will. But if you look at this one here, right, and I'll just kind of go second sentence here. It says, people brought anybody with an ailment, whether mental, emotional, or physical. Jesus healed them one and all. And when I read this, I'm like, wow, this is like the first time that I'm actually reading a Bible that actually is very, very, Jesus heals mental, emotional, as well as physical ailments. So that this really opened a lot of what I call doors in my mind to say, well, wait, if this is true, then what does that look like? What is the healing? What would that look like? Okay, so that's really was the driver, if you will, that kind of got me into this thing. Now, the second part is, what would this ministry look like? And here's a couple items. Hospitality. I think all faith organizations will offer hospitality. Faith organizations will offer some type of community, an acceptance. There is a forgiveness, and there's a concept that actually Jean Vanier calls accompaniment. And I'll tell you what that is. I'll show you what that looks like. And of course, when you belong to a faith community, you belong. And then there's also some components of restoring of the individual, because what we do know is, in many faith organizations, the idea of restoring the individual is a component of the ministries. How to go about doing this? So I follow Carlin's model and conducted worship praise services at mental health facilities. And here were my initial thoughts. Okay, so when I started doing this, I was a little nervous, right? Because I'm thinking, okay, well, I've never done this before. If I go to these facilities, and if I am bringing a message, will the message be relevant? Will the people there actually even get it? And then would it be appropriate? And then last and foremost, would this be meaningful for the people there? So I had all these thoughts, and I wasn't sure, and I was quite nervous that all of this may be really of value to people that are in these facilities. So what I did then, I said, okay, I'm going to kind of take Carlin's list of things that he did. And I said, well, let me see if I can kind of condense it a little bit. Because one of the things that the facility management said, well, can you kind of get it down between a half hour and 40 minutes, something like that, because you probably, that's probably the time span that would be most conducive. So I started that way, and you can kind of see version 1 when I did that, and I launched that in July. And then I said, okay, well, if I gave it a shot. And then, and you can see in August, I kind of revised it a little bit based on things that I can see, things that worked, things that didn't work. And again, and I'll talk more about that. As you can see, I can you can kind of see the items revised, meaning the praise music, volunteers. Volunteers was a big deal, and people actually wanted to be involved. And then you can see in October, again, I kind of added a few more things, and then try to streamline things and make it such that it's more relevant, if you will, right, for the people there. So here's some observations that I saw that I thought was pretty significant, right? So first and foremost is the significance of music. Okay, music was huge, and again, and there were times when the music was almost a way of relating, for people to relate to their faith. Uh, as I would play a praise song or something, and people would stand up and they're moving around, they're singing, and then when the song is over, I mean, I'll hear people say, "Hey, I remember hearing this song when I went to, this church, with my grandparents, or when I did this when I was a kid." So it really brought back, some relationships. Sometimes I say, what, in many ways, sometimes God leaves traces of sediments, right, of your spirituality, if you will, with you. And at some point, maybe there's a way of kind of, reigniting or kind of re-engaging. So the music was big. And after a while, what was even cool was, many of the residents would say, "Hey, next week, can you see if you can find this song? Can you see if you can find this song?" And I'm going, "Well, how would you guys know about these songs?" And thinking, and then he goes, "Oh, well, I used to, I listened to this, and I remember this when I went to church." So it really was to bring the community, and kind of almost draw people from their own faiths and spirituality formation, or their spiritual development. And then what was even more interesting that I found was that, because I was a one-man band, I didn't have musicians, I didn't have a lot of people. What I had was my smartphone and a Bluetooth speaker, and that was almost, in many ways, like, wow, this was like the best thing that can happen, because every time someone said, "Can you play this song? Can you find this song?" I said, "No problem. I'm going to go to my my Apple Music. I'm going to see if I can find it. If I do, guess what? I can play it right now." Uh, so it really provided a lot of opportunity and a lot of flexibility in terms of how the group actually engaged and how the group actually participated, which is the second section there, says, participation. And so it was a way to do that. Another way was to actually have people take turns reading scripture, and actually, having people becoming, what I call co-production. And that went over huge. And it's almost like, well, it's not what you think. So as we would read a scripture, as we read something that's spiritual, I would say, "Okay, well, what do you guys think? What do you think of this passage? What do you think is meant by this?" And then, interestingly, people would actually start to explain what they understand. They start to explain what the scripture passage may be saying. And I'm going, how did you, how do you know that? And again, it's, well, I remember this when I remember talking about this, at a church that I used to go to. I remember this, when I was doing fellowship with someone. So it was, again, another another, again, to me, it's like, wow, it's just, okay. No doubt, spiritual formation is actually already in place, if you will. It's just a matter of kind of bringing that to the forefront. Okay. And then the third one is the Eucharist, right? Or some people call it communion. Um, that was huge. That was significant. And again, because we were in a, secured locations, there were concerns about, well, even before COVID, right? Well, we're concerned about, you don't want to be breaking bread. You don't want to be doing that kind of stuff. You don't want to be taking a chalice around. And it's, well, there's ways of working around that. And I says, there's this thing that, that I use. It's called the communion kit. And I said, really? And I said, yeah. And it looks like this. Can you see the communion kit? So you can kind of see there's a wafer, and then there's the juice, right? So you actually would pass this out to every individual that would want to partake, and then you can, keep everything, keep it safe, and keep it so it's not the, you don't have to worry about any kind of contagions, if you will, right? So this worked out quite well. And I think the idea of the Eucharist was big. I mean, it would get to the point where, someone, let's say, and this happens, people say, oh, I forgot, I was sleeping and I forgot. And then they show up late and they say, hey, did you do the bread thing yet? Right. And it says, yeah, we already did it. Because, can I still do that? So again, you can kind of see, right, that, the people that were, interested in, spiritual formation, they certainly understood, why, the importance of doing this. And then the fourth one is praying, and how important it was to pray, and things that the residents are praying for. I'll kind of show you a breakdown of maybe the various things that many of the residents were praying for. But the next one was also huge: staff involvement. Okay, so again, many of the staff in the residence, of course, is with them, right, on a daily basis, and they rely on each other. They support each other. There's a lot of interaction that went on. What I can tell you is that at places where the staff is more involved, the residents became more involved. Okay. And what was even more interesting is as the staff members, and again, I was doing this on a Sunday, right? So as staff members found out that we were doing this, okay, they would come around because they're working on the shifts. They would come around during the communion, and they would actually partake in the communion. They actually wanted to be a part of that, right? So they'll look in, and I'll like, 5 minutes, come back in 5 minutes. And so, okay, cool, right? And they'll come back, and boom, they're there. And again, not only are the residents seeing it, but they're saying, oh, well, geez, guess what? Some of the staff members, right? I think they get where I'm coming from. So in many ways, it was our own way of kind of building a community, and how important it is for everyone to be in a community, and that we're actually, have maybe some common themes, and maybe even have some common threads between us. So these were what I would consider to be some significant findings. Okay. So earlier on, I said, well, how important is praying? Okay. So this slide here kind of tells you, okay, and over time, what I did is, I've kind of collected and cataloged, what type of prayers the residents were asking for. Okay. So if you take a look at this, 48% of the prayers from the residents were about their families and friends. Okay. That's huge. And so in many ways, it's like, wow, they so much want the relationship. They so much want the relationship with their families and their friends. and that they are constantly praying for them, right? So not one session goes by where, just about everybody that actually has a prayer request, I would say just about more, actually, in my opinion, is probably more than 50% is asking for prayers to about their parents, about their relatives, maybe someone that's about to be going to a hospital, having surgery, or going through some difficult times, about their children. They're praying about. So really, I mean, you can kind of see, how important it is. And then the next the next one that's significant is discharge and go home. Uh, that's also a very common one. I'm, please pray for me, and I would like to be discharged so I can go home. I would like to be discharged so I can go to a better place. Things of that nature, right? So again, it's to me it was pretty important there as well. Okay. So the conclusions that I found from my studies is really then, no doubt, spirituality can definitely be a factor towards recovery. I think that's a given. Interactions such as music, the Eucharist, participating, praying, and other activities are all part of being in the community, and how important that is, that actually people would look forward to being in a community, and how important it was that that it was there. And then staff acknowledgement, that was huge. Number one, acknowledging that, okay, it's okay if you want to do this, and then staff being committed to supporting uh, activities that actually allows people to have opportunities for spiritual formation, and also involvement was a significant factor, because the residents and the staff are now saying, we're in many ways we're kind of together in many of these things, and many of the spiritual things that we're talking about. And then the other thing, which is really the follow on, if you will, from the research that I'm doing, would be to invite and create opportunities for other faith traditions to also participate. So that's actually now a part of things, or a few of the things that I'm looking into doing going forward. Okay. So what are some of the things that I found? Okay. Is there evidence of hospitality? Is there evidence of community, acceptance, forgiveness, accompaniment, belonging, and restoring? Do I see signs of that, or does the did my project tell me some of these things existed? And if it did exist, what did it look like? Okay, so um, Jean Vanier came up with this word. It's called accompaniment. Okay, and in many ways, just being there can make a difference. Now, anybody seen the movie called Patch Adams? If you have, right, it's a Robin Williams movie, and Patch Adams is a real guy, and you see the picture. This is Patch Adams right here. Okay, so he was a doctor, and he said, well, if I can make people smile, if I can create relationships, or just being there, he can make a difference, and that's exactly what he did. So again, if you haven't seen the movie and you're interested, go look it up, Patch Adams, right? This is Patch for real, right? And the idea of just being there, right? I can't tell you how. I mean, to me, it's like, wow, that was the most important thing. And not only was it, I think, was rewarding or beneficial, it was beneficial for me to be a part of this, and to be a part of this community of and being kind of quote unquote accompaniment, or accompanying what's going on here. Okay, now hospitality, and again, most of us understand hospitality as something that we offer, right? So in other words, if a stranger comes to your home, you offer hospitality, right? The scripture tells us that, right? Strangers went and visited Abraham, And Abraham says, I'm offering you my hospitality. So it's something that, quote unquote, we offer. And I think we all kind of think that way, that it is us or somebody offers the hospitality. And again, throughout my project, I kept thinking about that. Okay, well, here it is. I'm supposed to be talking about hospitality from the faith organization and from the church. I'm going, I think it's beyond that. I think what's happening is the people at the residence center that are coming to these praise sessions, these worship sessions, are actually offering their hospitality to me. So in other words, it's I'm the one that's receiving their hospitality, because if they were to say, nah, we really don't want you here and we don't really care about this and go away, or we're not that interested, there'd be no relationship whatsoever. So I really do think that, in many instances, as you go, it's almost like someone in turn is offering that hospitality to you. So to me, I think that was a major finding for me, at least, of what that really means, right? Hopefully you can kind of get where I'm coming from. Okay, so the second part of this talk now is going to be talking about uh, can you do this? If you're interested, is this something that maybe you can do? Is this something that maybe you can do in your area, right? So first and foremost, and I kind of before I decided to do anything, I prayed a lot. I prayed about this, and I prayed about, do you really want me to do this? And if you do want me to do this, what does this look like? Okay, so and sometimes your prayers uh, get answered. Okay, so and I have a little time to kind of give you a little story. So some time ago, I was teaching Bible study. Okay, so and when I do this, I would do a session in the morning and I do a session in the evening. So this particular day, um, I was doing the session in the morning, and a stranger came into our group. Never met this person before. Came into our group and sat in the front, very attentive as we were going through this. And then towards the end, of course, the discussion went, okay, is everybody have a prayer request? And then this individual says, yes, I do, and started talking about the various requests that this individual wanted. And it kind of, and just kind of rambled on, right? And it didn't take long for us to recognize that very likely this individual maybe maybe suffering, or may be ill, maybe mentally ill. And we understood that, and we said, okay, fine, we're here to support. And it went on for a while. And then after the meeting, I said, well, is there something I can do to help you? And he says, well, I could use some money. And I said, well, I don't know that, I would be inclined to offer you money, but if you need clothing, food, or anything like that, let me know. There's ways for us to help you with that. He goes, oh, yeah, I think I'm good. And then, and I got distracted doing something else. When I came back, this person was gone. That evening, another person came. And again, first time I've met this individual, and this person was actually disabled. Okay, and then we started talking after, and he was sharing with me, the struggles that he was going through, including mental illness. And as we talked, we prayed, and I said, well, is there anything I can do for you? He says, well, can I have a Bible? I said, of course you can have a Bible. So I gave him a Bible. So and then the session was over, and I'm driving home. And as I'm driving home, I pull off the road, and I'm like, wait a minute, what just happened today? Right? So I'm thinking to myself, I'm like, oh, okay, so God, are you trying to tell me something here? okay, are you sharing a message with me or something? Right. So for me, the believer, I'm like, okay, well, maybe I'm being told that, it's okay to do this. Go and do it. Right. So again, to me, it was like, wow, uh, I don't know if that could be a coincidence, but it happened. So, and that really almost kind of, in many ways, propelled me to say, okay, well, this is maybe something I should try. Okay. So how can you go about doing that? Well, you can go and reach out to the local mental health facilities. Okay. And, what I did was I knew of a few facilities and I said, okay, I'm just going to go and contact them and tell them what I want to do. Tell them that you want to volunteer. Tell them that you may be interested in volunteering with some type of a spiritual group. Okay. Uh, and many facilities actually would welcome volunteers. Matter of fact, many facilities just, wow, we're so glad you contacted us. Yeah, we were looking for opportunities like this. We just didn't know how to go about doing it. Okay, so I actually get that quite a lot. Okay, of facilities saying, well, yeah, we're so glad that you're willing to do this. Now, what I'm going to tell you though is they're very many of the facilities would say, "Oh yeah, we can understand maybe like a Bible study or something like that, but if you want to come and do what? Oh, I want to come and do worship service." And they're like, "Oh no. Well, maybe we need to do it, And I said, "It's cool. I got this, right? So I'm gonna show you how I can do this, and it actually would be in a way such that it's very conducive to the environment that you may be concerned about." So that's to kind of open the doors, if you will, at the mental health facilities. But you should also be reaching out to your faith organizations and tell them what you want to do. Tell them, hey, look, you know, I want to go to these facilities and I want to go do this because there's a need for this. And many faith organizations, many churches, they get it. They know that it should be a part of their mission to go out and and again, many faith organizations that I am aware of now actually would say, we kind of have like a roadmap on if you want to do outreach like this, if you want to go do worship and at a facility like this, we kind of have the roadmap to do that because they very likely would say, well, we know how to do this if we go to a senior citizens facilities. We know how to do this if we go to maybe a VA situation, something like that. Because we kind of have the tools. We probably have never had someone say, "Can I use this now to go to a mental health facility?" Okay, so you kind of think about that. And again, like you see in the last bullet, volunteers are always welcome. Volunteers are always needed. Okay, all right. So uh, I'm going to kind of give you an idea of what you know what I did, so you can kind of say, okay, sample worship programs for under 45 minutes, and if my hyperlink works, I can pull it up and show you. Okay, can you see the Word file? Okay, so hopefully you can see the Word file, and you can kind of see the program. And again, as you can see, many of what we do is listed. The praise songs are listed with the words, so this way, if the residents want to sing along, they can, and then you can kind of see how things work sequentially. So every week, I would print this out, and as if I'm doing service, right? I would then have all of this available, go to the facilities and pass them out, and then we actually would actually follow the program, if you will. Okay. All right, so let me get out of this. Okay. Now, when COVID came along, it was a bit of a stretch trying to do this. Okay, so so I was no longer able to go to the facilities. So we said, well, can we do this remotely? And then, the first response was, really? You want to try that? I'm like, yeah, I do. Right? And I said, I think we can do this. I know how to do this. I know how to do remote stuff. Right? So then we came up with, how can we go virtual? Okay. So when we did that, we actually started doing virtual sessions, and you can kind of see this one here that was done in May of this year, and you can kind of see the same kind of format, and then same kind of program, but because it was done remotely, I was actually able to pull from it. One second. Sorry. I was able to incorporate many of the things that you would find, on YouTube. So so when it comes to praise music or singing together, instead of us being in the same room singing, I would say, hey, check out this one. It's Kelly Clark, Broken and Beautiful, and then I would play it, and I won't play the whole song, but I think you get the idea, right? So the idea was, okay, we can actually still have some some interaction, some interaction with music, and how to actually continue to incorporate that. And then the only thing I haven't figured out yet is how to do the communion. So that's something that I'm actually working on next. Okay, so I just thought I'd share this with you. Okay, now, oops, sorry. Okay, so let me keep going a little bit. All right. So before I get to the questions, okay, I wanted to go back to my initial discussion about, well, if you think that this is something that should be done, why is it that people may be hesitant? Why is it that you may not be interested in doing this? Why is it that you may be afraid, if you will? In many ways, you might be of doing this. Okay, so now I'm going to go back to the references I looked at and talk about. Okay, so when I the first time I read this, it was pretty interesting because there's a section that says, you think people, actually may be hesitant to engage in situations or with people that may be marginalized. And then Dr. Beck says, well, it may have to do with this, the psychology of disgust. And I'm going, that's interesting. Like there's a psychology that talks about being in disgust. And I said, well, that's pretty cool. And the sample that he provided was, he goes, imagine, you imagine this. He goes, I give you a Dixie cup and I ask you to spit in it, okay, and put it down on your desk. And 5 minutes later, I ask you to drink it. Would you drink it? Right? And I would venture to say the majority of us would say, no way, I'm not doing it. There's no way that I'm going to, pick up my own saliva and, that's been sitting out and ingest that. It's not, I don't think I can do that. And he says, well, that's really the essence of the psychology of disgust, because when you think about it, unbeknownst to you, if you will, right, or you may know, right, saliva in your mouth, you are literally swallowing your own saliva probably about every 10 seconds. You just don't even realize it. However, when it leaves your body, now it's left the boundary zone. Once it leaves that boundary zone, then it's like, whoa, I don't think I can engage now. And in many ways, that's really, in my opinion, one of the things that we're trying to overcome of how did we create these boundary zones and how can we actually, move closer and closer so that those boundaries actually goes away. And then going back to, okay, well, what can we do and how can we do this in a community? It's really about, you know, breaking down these barriers, breaking down these boundaries and say, you know what, it's okay. It's okay for us to come together on a Sunday where you are. It's okay for the staff and residents to come together and break those kind of bounds, if you will, right? If nothing else, only for this session, so that people can say we are in a community, and being in a community, and being in a community where my faith would say being in a Christ-centered community can make a difference. So in essence, I kind of wanted to leave you with that. So this way you can kind of say, oh, okay, I kind of get this. It's about, you know, uh, creating relevance. It's about, ensuring that there is appropriateness and ensuring. And again, from my work and from my projects, I can tell you that uh, what I experienced actually did have relevance. It was, in my opinion, appropriate and actually was also meaningful. So with that, I'm going to close. And if anybody have any questions, any comments, anything that I can help with, I think, Angela, this would be the breakout session. Is that correct?
Yes, indeed. So
Okay.
I'll hop back on with you. Thank you so much. Such wonderful information. And, for those of you that are joining us, I was just sharing with Paul, how important this conversation is, for so many of us that, have a spiritual or faith background. It's been a little bit taboo to kind of cross the bridge and talk about how, two very significant things that affect our lives every day, haven't really, we really haven't held space to have the conversation about how they can work together and how one impacts the other. And so, thank you so much for bringing this information to us, the work that you're doing. I know with our NAMI families, not just in Orange County, but you've been a huge supporter and contributor to the NAMI California work that we're doing with RAND down in the Latinx communities in San Bernardino and
Yeah.
Riverside.
Mm-hmm.
So we've got there's the chat box within Zoom. There's also the Q&A and the chat box on the Whova app, depending on which platform you are joining us from. So I'm gonna look at both of those. We've got some questions here for both. Let's see. Okay. So the first question I have here is, where is it? There we go. Okay. Your study supports a Christian approach. What about other faiths? How do you handle that and have other faiths feel welcome?
Yeah, and that's a great question. And again, I like I said in my studies, really the next piece is how do we now, create a more of a interfaith in exchange where others who may be interested from other faiths can actually participate, and how would what would that look like, um, and how we could actually create those environments. Okay, so there's research being done at Duke University, and they actually provide quite a lot of literature on uh, you know spirituality and faith and mental illness, but looking at other faith traditions as well. So Harold Koenig does a lot of that. So there's a lot of literature on how you can do that, and then absolutely. If I think if you say, okay, there may be other faith traditions that would be interested in doing this, absolutely. I would, again, if I was talking to an imam, and I do, right? And I would say, okay, well, if you had this opportunity for a 30-minute interaction, how would you do that? Right? And if I was going to a synagogue and say, what, if you had a 30-minute, opportunity to do this, what would be the appropriate way to do that, and how can I help you facilitate it so that actually it becomes relevant, it becomes meaningful, and it's something that would be appropriate, not only for the residents, but also to your faith tradition. So it has to be, what here's the boundaries or the barriers, if you will. Here's the limitations. How can we create an environment where, someone of your faith can actually enjoy that? Now, having said that, there were people that actually came to my sessions that are from different faith traditions. Okay, and interestingly enough, right, there were discussions about what may be similar between the faiths and what may be different. For example, I had quite a very interesting discussion with someone says, look, I come from the Jewish faith, and I think I understand my God. Is it okay for me to be here? And I said, absolutely. And as we started the dialogue, said, well, yeah, well, if an opportunity came along, we certainly could actually introduce, faith leaders from your tradition to actually come and talk as well. And I said, that would be great. But the idea is that the dialogue is started.
Absolutely. And I think, that's a really simple approach that we've seen in a lot of different areas, going into the education space and wanting to know, how do we talk to young children, and really just trying to, it's sort of that first rule of presentation anyway. Who is your audience and how do you tailor the message? And so I think that,
Yeah.
great point. The next question that came in from Elaine says, do you find that some individuals were so medicated that they could not relate to the methods used?
That's an interesting one as well. What I can tell you is, again, the times that I was in these facilities, I started to really, learn a bit more and appreciate, the interactions there. And I do one in the morning and I do one in the evening. And very interesting is that they made sure that my session was after the morning breakfast and then their medication. So it was done in such a way that they were, quote unquote, they've already gone through their morning rituals, if you will, and then here's a session for that. There were times when people would come in and again, I'm not a medical professional, so I wouldn't be able to say what was going on, but it would seem like they may be under a bit more medication than what I would be what I would think would be kind of like the prescribed dosage, if you will. Again, I'm not a medical professional, so I wouldn't be able to speak on that. But even at that, I mean, people would come in, and they would smile, they sit, and they would, I think they recognized that this was some type of spiritual formation, and they would be there, and sometimes people actually may be a little bit disruptive for whatever reason. And again, when this is also so interesting, when these types of episodes would start, the other residents would say, "Hey, cut that out! Can't you see we're doing this right now? Can't you see we're worshiping? Chill for now." So they're actually, picking each other up to say and I said, you know what? That's exactly what we should be doing. We should be here helping each other. We should be here lifting each other up. So really, it was an opportunity to say, no matter what your infirmary is, you're in the right place.
That's great. Thank you.
Yeah.
And then we did have in the session Q&A on the Whova platform, a question asked about what kind of training would you recommend to help volunteers feel equipped to do this ministry? And I would like to say first and foremost to Roxanne, Roxanne provided a slate of resources from Santa Clara County Behavioral Health Department's website, as well as some additional resources that are in here. So just first and foremost, thank you so much to Roxanne for gathering all of that and sharing that with our participants. But do you have any thoughts on that question, Paul?
Yeah, absolutely. And again, thank you very much, Roxanne. And again, I think the good news is that actually many of the counties that I'm hearing, right, even at the county level, there is a recognition of, the need to have, spirituality as part of the overall kind of treatment or what would be available to people. Now, how to become equipped. Okay, so again, that's also a question that I get, and I said, well, and they will say, hey, look, if nothing else, you actually gone through some training, so you have an idea how to do this, but I've never been through anything like this, and how do I go about doing this? Okay, so if you are interested in doing this, first and foremost, I would say if you belong to a faith organization, go talk to your faith leaders and say, hey, look, this is what's going on. This is what I would like to do. Can you help me? Can you equip me to do this? Right? And many churches may have opportunities to do that. So in my faith tradition, you can actually go to training to become, a lay servant or a lay ministry, where you can actually learn to do this. And many faith organizations will actually, have training programs where you can do that. And then, over and above that, in fact, there's a church that I'm working with right now, and they said, by the way, we have an entire kit. So if someone were interested in actually reaching out and want to actually do worship service, we actually have a kit that we can provide. Okay, so I'm actually going to be engaging with them this afternoon. So if anyone on this session would like to, maybe see what this kit looks like, you have my email, and if you would like, send me an email, and once, as soon as I get this kit, I'm more than happy to share it, and this way you can kind of see. But to me, I think the big challenge was getting the courage to want to do this. I think once I got to, I'm ready to go, I'm ready to pass that boundary line, and I'm ready now to go into, the quote unquote, the danger zone, right? Okay, fine. I'm willing to do that. And to me, once I made that decision, relatively speaking, the rest was easy. And it was almost like, not the residents there, they were like cheering me on. Hey, let's do this. Can you do that? Can you bring this music? It was like, oh, we're working together to make the best of this. How cool is that? So really, I think it's, more than anything, it's like, I would say, if you have a serving heart and you want to do this, I think the rest is easy.
That's wonderful. It's really inspiring and really closes us out with such a message of hope and enthusiasm and connection in this work that we're all doing. There's always so many moving parts and pieces. And so,
Yeah.
and we can bring someone along with something that resonates with them and is such an important part of who they are. I think, we're just taking that next step, together in this system.